As many as 30 to 85% of breast cancer and melanoma cancer survivors who have lymph nodes removed as part of their cancer treatment will develop axillary Webb syndrome, also called cording. But what exactly is cording and how can you manage it? In this video, which is the first of a two-part series, I'm going to dive into cording, how to tell if you have it, and how it's managed. In the part 2 video, I'm going to go through 8 different exercises that you can do to help get rid of that cording and improve your range of motion. Hi, I'm Alex Hill, and I'm your physical therapist for everything oncology and lymphedema. I'm a board-certified oncology clinical specialist, and I'm also a certified lymphedema therapist. Make sure that you subscribe, turn on those notifications for my channel so you don't miss any new videos on oncology and lymphedema conditions. Among cancer survivors, axillary Webb syndrome or cording is most commonly experienced among those who have breast cancer or those who have melanoma cancers. This is because the axillary or armpit lymph nodes are removed in many of these surgeries. Cording is a visible and palpable cord or multiple cords that are underneath the skin in the axilla or the armpit. It'll typically start here in the armpit and can run all the way down through the elbow, down into the arm, sometimes even into the thumb or the fingers. That cording can also go from the armpit and go down the trunk. They are tensed and pulled tight when you move your shoulder out to the side, called abduction, and straight forward reaching up, called flexion. The cording causes pain in the areas that cording is located as you do those movements and can limit your mobility and function and cause a lot of pain. Research studies have found that cording is basically a thrombosed or a clotted lymphatic vessel. We aren't sure why it happens with some people and it doesn't happen with other people, but some risk factors include a lower BMI or body mass index, a younger age, and some research has found that it may also happen more often with people who have more extensive lymph node surgery called a lymph node dissection, which is where they remove the majority or all of the lymph nodes in the axilla. And that's compared to somebody who has a less extensive surgery called a lymph node biopsy, where they just take a couple lymph nodes out of the axilla region. Now, although this has been found in some studies, it is still debated if there is truly a higher risk with getting cording if you have a more extensive surgery. Cording most often develops in the first 2 to 8 weeks after a surgery, but it can even form months or even years after that surgery is completed. Cording can resolve on its own, and for a lot of people that does happen, usually within 3 to 4 months after onset. However, a lot of people will also continue to experience cording and it doesn't resolve on its own beyond those 3 to 4 months, and it can continue to cause issues with mobility, pain, and function. Because it doesn't resolve on its own for a lot of people, this is why it's so important that we diagnose it early and we start treatment early to get rid of those cords and get that mobility back. So, how do you screen for it? Well, there's a very simple screening test that you can do on yourself. So let's go through how to do that. First, you're going to stand in front of a mirror and then take your affected arm and raise it out to the side. You're going to look and feel for any cording that's in the armpit, that's going down into the arm, into the elbow, or into the hand. And also look and feel for any cording that's going down into the trunk. Then you're going to take your same arm, you're going to reach it out in front of you and start to lift it up. As you lift up, again, check, look, and feel for any cording that's in the armpit, anything that's going down into the arm, or anything that's going down into the trunk. If you do see or feel a cord that's in the arm or in the trunk, make sure that you contact your medical provider and start working with a physical or occupational therapist who's trained in oncology rehab. Once you're diagnosed, it's important to start getting the best treatments that are available. Cording is treated with multiple interventions, but the primary ones that will help to resolve that cording and get your arm back to that full range of motion and function are exercises, stretches, hands-on manual therapy and scar release, manual lymphatic drainage or lymphatic massage, compression, including compression bandaging and compression sleeves, and kinesiology tape. I'm including links down in the description if you want more information specifically on manual lymphatic drainage or that lymphatic massage for the arm, compression bandaging, and kinesiology tape for the arm. I hope you found this video helpful in understanding this common condition that is associated with breast cancer and melanoma cancer when lymph nodes are taken out of the axillary region. Again, this is part 1 in a 2-part video series, so make sure you watch the second video where I guide you through specific exercises on how to actually treat that cording and get you feeling better. Please like this video and subscribe to my channel so that you don't miss any new videos on oncology and lymphedema management.